Now, a week out from the federal budget, the Consumers Health Forum is launching a campaign aimed at reforming the dental care system.
It says current waiting list figures are horrifying. Stephen Murby is the chairman of the Consumers Health Forum of Australia and he joins us now in the studio. Good morning. Thanks for being here. How many people are on the waiting list and how long are they waiting?
Across the nation, we're looking at over 650,000 people on the waiting list.
How long are they waiting for? What are
They're waiting for periods over 2 years, if they can actually even wait that long. And some people just give up waiting. In the past 2 years, we've had over 2 million Australians who needed dental care just not get it.
And it's not minor dental, always the case of it being minor dental treatment we're talking about here.
No, we're talking public dentistry and the state of public dentistry in this country, and that ranges from really serious things such as tooth decay, which I know sounds funny to say it's serious, but it is the harbinger of more health issues, through to really complex dentistry, yes.
The scheme you're talking about is very expensive. Do you think there's likely to be any funding for it in the federal budget?
There needs to be funding in the federal budget. This has got to a crisis. In fact, actually, it's gone being a crisis. It is, in fact, a disgrace. It is a shame for this nation. We are looking at some of the most marginalised people in this country who have less than the dental healthcare access in the third world. I mean, it's appalling for people who are homeless, for people who are Aboriginal and Torres Strait Islanders, for the aged, for the chronically ill. There is no real system to provide them with public dental care that they need.
Even if there isn't money there for a full-scale dental scheme, would you like to see the government do what it's just announced regarding the disability insurance scheme, at least starting something, a trial period in some regions of Australia to provide some comfort to some of the people you're talking about?
Yes, but it's not a matter of economics. In fact, if it was a matter of economics, then we should look at the lost productivity. Work has been done at the Menzies Policy Centre that shows that we lose $2 billion a year in lost productivity due to the lack of a public dental health scheme.
The Greens say that they want at least $1 billion committed in this coming budget to this dental care scheme. Would that satisfy you?
I think that's the right sort of figure to start with, absolutely. What we need to be able to do here is to reform the whole healthcare system. It isn't just putting in money, it's about doing reform. It's about extending the role of people like dental hygienists and oral therapists. It's about providing more places for young graduates to enter into public dentistry. So it's a whole reform package. It's just not money to pay for someone to go to receive dental care.
And if you're on a very opposite point there, it's all, it's very much about encouraging dentists, be they newly minted graduates or more experienced dentists, from going from lucrative private practice into the public system. Absolutely.
And again, a lot of us see the world through living in big CBD environments, but go to rural and regional Australia. You don't have to go to remote. No. And state of dentistry, public or private, is appalling.
Stephen Murby, thank you very much for your time this morning.
Thank you.
Thank you.